part of our public health program where we do surveillance for mosquitoes of public health significance, which means mosquitoes that can transmit human diseases.
It's a very delicate little creature. You know, it's one of the world's most deadly creatures.
A lot of things have to occur for a mosquito to be able to transmit a virus. First, they have to pick it up, and they do that by taking a blood meal. In the case of West Nile virus, for example, that would be a blood meal typically from a bird. And they would take a blood meal from a bird that's carrying the virus, it would go through their gut, and then it has to go to their salivary glands. And then when they take another blood meal, if it happens to be a human, they might have a chance of transmitting that illness to the human. West Nile virus, for example, is a debilitating illness. People can become very sick. People can have long-term effects with flaccid paralysis, for example. And some people, unfortunately, die from West Nile virus. Mosquitoes can breed in as small as like a bottle cap full of water. It doesn't take much.
Now let's say we have a monsoon rain that comes in and dumps a whole lot of water, as we see on a good monsoon season, and you have all these puddles standing in the desert. Female mosquito comes along and lays her eggs in that water. Let's say that water dries up before those eggs mature through their larval stages to become full-blown adults flying and capable to spread the disease.
And then when you get the rains, all those eggs hatch at the same time, and you get big blooms of mosquitoes, and they're voracious biters, and people really don't like to deal with them. Luckily, that particular type of mosquito is not associated with disease. Not all mosquitoes are the same. There are some mosquitoes that can transmit illness, and there are others that don't. The ones that do carry the disease are typically use standing water that's there for a while. For example, the mosquitoes that transmit West Nile virus are associated with things like open septic systems, abandoned swimming pools, long-term standing water. So our staff go out and they set traps.
Basically, you have a dry ice container. Mosquitoes are attracted to dry ice. You ever wonder why they fly around your face? Because we exhale CO2. So we use CO2 to attract them. So we have a dry ice container, and then we hang a fan. Below that is the net bag. So they're attracted to the CO2, they come in, they fly down through the fan, and they can't fly back out.
It's based on high science. That part has been simplified to the point that it can be done in a lab like ours.
I'm able to take the mosquitoes out of the freezer that I had picked up this morning. They're on chill, they're not dead. They're on chill, they're anesthetized. If I were to take those out and just put them on a table, they would reanimate and fly away. We are in the new Pinal County Environmental Health Mosquito Lab. This is a whole new structure. The lab was opened in April of 2023. We were able to have this lab built to the specifications to make us a state-of-the-art facility. We have a lot of our same equipment that we had before, but we have this wonderful new facility to house it in. Just outside of the doors here, we have our storage facility, and we have our Gila Topminnow. We are a pilot program with the Arizona Game and Fish Department to help the endangered Gila Topminnow. Gila Topminnow is a native fish to Arizona, and in 1967 it was put on the endangered species list. We're able to breed and put them in locations throughout the county, such as green swimming pools. Let's say you're a homeowner and you're having a struggle, your pump goes out on your pool. If you have a pool that's going to be standing for a while, give us a call. We'll bring out our Gila Topminnow and place them in your pool. They eat mosquito larvae, and that will keep any nuisance of mosquito breeding from happening. We'll bring them out, put them in your horse troughs, your backyard ponds. We can put these fish in any location that does not overflow into a waterway. One of the most talked about conversations, why, when, and where we fog. Well, the answer to that is we use our surveillance data from our mosquito trapping to determine what locations may need to be fogged. Mosquito fogging is using a truck-mounted, ultra-low volume mosquito fogger to use adulticides to kill adult mosquitoes that may be present at a given time in a given area. We like to fog when we feel that there's going to be a significant public health outcome from that fogging, not just to fog because there's complaints coming in about mosquito problems. We're going to get complaints about mosquito problems year-round. Fogging is not the answer. the answer to the problem is source reduction. So one thing that we want to do is look around our backyards. Mosquitoes will breed in a container as small as a soda pop cap. If you have dog water bowls or even the $10 kiddie pools, those will breed mosquitoes like there's no tomorrow. In 3 to 5 days, you could have adult mosquitoes flying away, capable of biting and spreading disease. You know, we've taken this desert and we've made it comfortable to live in. We've also made it more comfortable for the mosquitoes.